My name is Adityanath Jha. I am the CEO of Crayon Pictures. Last year, 2014, my head was splitting. It was as if I had an earthquake inside my head. I have not visited a doctor for the last 30 years. And that's a friend of mine whose judgment I respect when it comes to hospital, because I don't know anything about hospitals. My instinct was to go to some other hospital, but he said, we'll go to Vikram Hospital. That's the best place for anything to do with your head. Once I came to the hospital, they did a CT scan and took me into an ICU immediately. It turns out that I had a brain tumor.
Aditya Jha has been an interesting case because he presented with a sudden severe headache associated with vomiting. When such a patient comes with this history, young person, we suspect some kind of a bleed in the brain. And naturally we did a CT scan first on him, and CT scan showed us features suggestive of sagittal sinus thrombosis with some bleed in the occipital region on the right side. This is the time when we thought young person coming with a cortical sinus thrombosis with a bleed, we were thinking whether he has had a dehydration due to overnight some function or something. And then we decided, after discussing with the neuroradiologist, we said we'll do an MRI to see what has happened. And MR venogram, and then subsequently we did a contrast MRI, which showed very surprisingly a lesion in the torcula on the right side with evidence of bleed. When you see such rare lesions in this region of torcula, we really thought whether we are dealing with something like a metastasis or a rare tumors which bleed in the brain. So we did discuss this with the matter, and initially we started him on anticoagulant with Clexane because sinus was thrombosed, so we decided we should prevent further thrombosis and complications related to this. And we decided that we will discuss with the family about his wife was also not here, and we decided we will discuss this once the family members come. And at that time, with all possibility, we thought whether there could be a metastasis. And we did do a PET scan to look for any other lesion other than this torcular lesion, and we are convinced that we are dealing with a right side occipital torcular region tumor with a bleed, a possibility of some kind of meningioma or other vascular lesion. And we decided we'll give him anticoagulant for about 2 weeks and readmit him for definitive surgery. And that's what we precisely did. He was admitted in the last week of September. Then with his family's consent, we fixed up a date after 2 weeks, and we did a right occipital craniotomy and did a resection of the tumor. A small bit of tumor was encroaching into the sinus torcular region. As you know, there is a major drainage system there. We usually don't try to interfere in that, either to cause excess bleed or to the thrombosis. So we did leave some small bit of a tumor, which we thought we could be able to do it with a gamma knife in post-operative period. And that's what we precisely did after that. And he has done wonderfully well. He has been off the anticoagulant after 3 months, and now he is doing perfectly fine.
When you look back at a hospital, what do you look for? You want very good doctors. Now, obviously, my friends and family, they did research that if you have a brain tumor, who are the best neurosurgeons in the country, who are the best neurophysicians in the country, do we need a second opinion, a third opinion? They called up everyone from Cochin to Delhi. They called up healthcare companies, all our contacts, and everyone said one thing: you're in Vikram, you're in the hands of the best neuro department. The surgeons and the physicians are rock stars out there. But equally important from a patient's point of view and the patient's family point of view is how the doctors interact with the patient and the family, because the patients and the family are anxious. They need the truth. They need truth explained to them completely, simply, and honestly. And the doctors here, each one of them, Dr. Rajesh Iyer, Dr. Raghavendra, Dr. Sudhir Pai, Dr. Chandramouli, Dr. Kishore, each one of them spent an amazing amount of time with me and my family at every step, explaining precisely what is happening, What are the alternatives? What are the different points of views? How can it impact me? What are the dangers? In simple language and in an extremely friendly way that, that inspires comfort and confidence. You know that you are safe. You know that the doctors know exactly what they're doing. And you trust the doctors. And they have a process in which the second opinion and the third opinion are all inbuilt into it. Because the neurophysicians and the neurosurgeons and the radiologists and all of them come together to discuss the case, in which all kinds of opinions, everyone's own interpretation, what if this is the situation, what if this is the reason, it's all inbuilt into the process. And that's a great thing. And the patient is kept informed. It's not that you hide it away from the patient. For example, it was told very clearly that the tumor is not the real danger. The question is whether will you live for the next 24 hours or not. Because the main blood supply out of the brain is blocked, if the blood does not find alternate paths to come out, there can be disastrous consequences. So we went home, we came back after 10 days, and before the operation, in every hospital, you have to sign a consent form. And I went through the consent form, and the consent form was exactly what the doctors had told me. I had absolutely no problem in understanding what was written out there, because that's what the doctors had explained to me. I mentioned to Dr. Sudhir Pai, you know what, I forgot to tell you how much I appreciated that consent form of yours. The simplicity of that consent form of yours. No swimming, no driving for the first 2 weeks, no going into public spaces for the first 10 days. After that, just go ahead and live your life. And that's what I've been doing. I have to take an MRI every 6 months for the first 2 years to check if it is growing, and then every year for the rest of my life. That's just about the only thing I have to do. And thank you, Vikram. Thank you, Vikram Hospital. Thank you, all the doctors, as I said, Dr. Chandramouli, Dr. Sudhir Pai, who operated on me, and their team, their entire team, Dr. Rajesh Iyer, Dr. Raghavendra, Dr. Kishore, plus the entire team, support staff, all the nurses, all the brothers, everyone out here. Thank you so much.